Do you know how much it costs to have a private hip replacement? You might be surprised. Keep watching and I'll tell you all about it. I don't know why, but here in Britain we've always been reluctant to talk about private healthcare. Maybe it's because we have a National Health Service, which was set up to be free at the point of access. It's certainly a political hot potato, never more so than now. So how much does it cost to have a private hip replacement? In the United States, it's about $70,000. In the UK, if you have private health insurance, then that should cover most of the costs. But insurance is expensive, particularly as we get older. Some of my patients pay several £100s a month for their cover. If you want to pay for yourself, it's about £15,000 in the UK. That's a huge amount of money for anybody. For that much, you could go on a world cruise, have a fantastic holiday flying business class, buy a decent second-hand car, put it towards a new conservatory or home improvements, or blow it on a nice pair of watches or jewellery. These things aren't going to make your painful, stiff, arthritic hip feel any better though. If you decide you want to invest in a new hip instead, what should you expect to get for your money? Well, for my patients, they'll have their surgery done at the Nuffield Health Wessex Hospital or the King Edward VII Hospital in London by an expert hip surgeon, me, supported by a brilliant team of anaesthetists, nurses and physiotherapists. All of the preoperative and postoperative care, physiotherapy and the costs of dealing with any complications are all included. All of my patients have my personal email and phone number, and I'm always available to offer advice. You could of course get it done cheaper, maybe by going abroad, but remember, look at the small print very carefully. When it comes to your health, the devil is in the detail. If you'd like to know more, then please get in touch, phone the office or send me an email. Thanks for watching. I'm Jeremy Latham. I'm the hip surgeon.